Hello everyone. Today I am delving into the topic that might be most important to discuss and is incredibly important for many couples out there who are trying to conceive and planning to bring a new life into this world. I am talking about semen analysis and what they mean for your reproductive health. If you are a couple who comes for fertility evaluation, did you know which is the most important and the first investigation that is conducted? It is the semen analysis. Yes, either this test has to be done first or the couple's evaluation should begin together. A normal semen analysis puts an end to any further evaluation for the male partner, but if it is not normal, then further tests are actually warranted. Hello everyone, myself Dr. Indu from Samruddh Fertility and Urology Center. Whether you are a newly married couple or you have been on the journey to conceive for a while now, then stick around because this information could be important or crucial for you. Let's dive into the details of semen analysis. Firstly, what exactly is semen analysis? Well, it's a diagnostic test conducted to evaluate the health and the viability of the man's sperm. Essentially, it helps determine a man's fertility potential. When is the semen test said to be abnormal? When the volume of the semen is less than 1.5 ml, if the count is less than 15 million per ml, if the motility is less than 40% in the total ejaculate, and when the morphology is less than 4%. A gentleman can have one parameter abnormal or it can be a combination of all the 4 parameters. Now, when we talk about the semen, we are not just referring to sperm. A semen is a fluid that contains sperm along with other substances produced by the male reproductive system. Now, this fluid provides all the nourishment and protection for the sperm, aiding its journey through the reproductive tract of the female to fertilize an egg. Very briefly now, I'll take you through the instruction that needs to be followed before the gentleman produces a semen sample for semen analysis. The period of abstinence is very important as it affects both the quantity and the motility of the sperm. Abstinence period should be between 2 to 5 days and not outside this range. Collection should be done at the center preferably, and if there is any history of infection or antibiotic intake, please bring it to notice of the endotechnician. Bladder should be emptied and entire sample should be collected into the container which is given at the center, and this should be preferably by masturbation with no spillage. Condom should never be used for collection of semen by intercourse. If you are not able to do the semen sample collection at the center, then you have the choice or the option to do a home collection and get the sample within 30 minutes to the center. If you are finding it still challenging, still very difficult, not able to produce a sample at home also, then please consult the fertility specialist and understand what is the cause and come out with a solution. Time of collection has to be noted or informed to the junior embryologist. So this was all about the instruction that a gentleman has to follow. So when is the semen test called normal? Well, there are several factors that fertility experts look at to assess the health of the sperm. These include volume of the semen, sperm count, sperm motility and sperm morphology. Let's break it down further. Sperm count refers to the number of sperm present in a given sample of semen. Ideally, the healthy sperm should have 15 million sperm per ml. Now, what is next? We have to look into the motility. Now, this parameter is very important. It is the ability of the sperm to move effectively, and it is crucial because sperm is needed to swim through the female reproductive tract to reach and fertilize an egg. Typically, at least 40% of sperm should be motile for an optimal fertility. Lastly is the sperm morphology. It refers to the size and the shape of the sperm, and any abnormalities in the sperm morphology can affect the ability of the sperm to penetrate an egg. According to the WHO edition, that is 6th edition, 4% of normal morphology should be there for an optimal fertility. Now, if these parameters are out of the range, it could indicate a problem with fertility. However, it is essential to remember that a single abnormal semen analysis doesn't necessarily mean that you are infertile. A repeat analysis after 2 to 3 weeks is advised to confirm this abnormal semen report. Sometimes lifestyle factors such as obesity, underlying health conditions, or even temporary health issues can affect the sperm quality. So alright, now that I have covered the basics of semen tests and what constitutes an abnormal result, then what's the next step? Well, if you are a couple who is experiencing difficulty in conceiving, it is crucial to consult with a fertility expert. Your doctor can help interpret the results of the semen analysis and recommend any further testing or treatment if necessary. If there are other factors such as your overall health, lifestyle and medical history, these are also important, which are considered in developing a personalized plan for you. Additionally, there are steps that you can take to improve the sperm health naturally. So maintaining a healthy lifestyle that includes regular exercise, balanced nutritious diet, avoiding excessive smoking, excessive consumption of alcohol, and also managing stress. All these can positively impact the sperm quality. Remember, infertility is not just a woman's issue, it affects couple as a whole. By being proactive and seeking appropriate medical care, you can increase your chance of conceiving and starting or growing your family. So friends, that's a wrap up of today's video. I hope you found this information helpful and powerful. If you have any questions or topics that you'd like me to cover in future, then feel free to leave in the comment section. Until next time, take care, stay informed. Bye for now.